Hello, my name is Dr. Daniel Kantor, and I'm the president of the Florida Society of Neurology and the medical director of Neurology, an organization dedicated to patient care, research, and education. In this abstract that I'm presenting at the American Neurological Association annual meeting in Boston, Massachusetts, in October 2012, I present a case report of a patient with chronic daily headache for over 20 years who responded to fixed-dose dextromethorphan plus quinidine. Chronic daily headache affects 3 to 5% of the American population and populations worldwide. It is one of the largest public health problems we have, and there are very few treatment options. Dextromethorphan is an NMDA receptor antagonist, as well as a sigma-1 agonist. By blocking glutamate both presynaptically as well as postsynaptically, there is possibility that it may be used in the treatment of pain. In fact, studies have shown that it's beneficial in diabetic peripheral neuropathic pain, and there is an ongoing trial looking at the central neuropathic pain of MS. Memantine, another NMDA receptor antagonist, has been studied and used in patients with migraine. For this reason, a 54-year-old woman presented with greater than 20 years of chronic daily headache. She had tried and failed multiple medications, including onabotulinum toxin type A, trigger point injections, as well as inpatient hospitalizations and outpatient infusion therapy. The patient was started on fixed-dose dextromethorphan 20 milligrams and quinidine 10 milligrams twice a day. Within a few weeks, the patient went from having 20 years of chronic daily headache to rating her headaches as 0s and 1s out of 10 in intensity. Instead of using 4 Excedrin or acetaminophen, aspirin, and caffeine a day, she went to taking 2 in a month, and she stopped taking oxycodone with acetaminophen at all. The question becomes whether this is a placebo response, and in fact this patient has had such a reduction in her headache frequency and intensity for over a year. Therefore, based on the mechanism of dextromethorphan and quinidine, where the quinidine blocks the dextromethorphan from being broken down by the CYP2D6 enzyme into dextrorphan, and the active ingredient dextromethorphan, which is an NMDA receptor antagonist, it makes sense that there may be response to patients with migraines, and we still need to explore whether it makes more sense for episodic migraine or for chronic migraine. Because of the results here, it makes sense to continue with further research, and further research is warranted, including double-blinded, randomized, controlled clinical trials. Thank you so much for visiting the poster at the American Neurological Association annual meeting.